Good evening and happy Juneteenth. I am Brother Dr. Jeffrey Sterling, the Surgeon General for Alpha Phi Alpha Fraternity Incorporated, and on behalf of our General President, Brother Lucian Metellus, our Board of Directors, and the Deputy Surgeons General, I want to welcome you for this next in our webinar series. I'm just so excited to be having this topic and to be having our guest this evening because it's a topic that we need to talk about. You know, one thing that I am just personally interested in is transformational change from one generation to the next. And with the healthcare outcomes that exist in this country in general and in the African American community specifically, it's past time that we have meaningful conversations and help grow our future leaders such that we can do better. The health of Americans, young Americans specifically, actually has declined in many ways since their parents' generation. Death rates for young Americans have also recently dropped after falling steadily for most of the 20th century. The pre-pandemic rate in about 2019 or so amongst individuals between 25 and 39 increased by about 17% since bottoming out in 1999. This increase in mortality amongst young people is mostly accounted for by men, which is why Alpha Phi Alpha is so intent on making sure that we eradicate the causes of these things. And it reflects a rise in externally caused deaths, which includes suicides, accidents, and overdoses. While the uptick in suicides is notable, the single largest contributor to the jump in young people's mortality is unintentional drug overdoses, reflecting the devastating impact of the opioid epidemic on this generation of young adults. Furthermore, the prevalence of obesity, which further and downstream will increase the risk of heart disease, cancer, and other diseases, has more than doubled amongst young Americans between 1990 and 2018, from 18% all the way up to presently being 40%. Injuries, including motor vehicle injuries and drowning, interpersonal violence, self-harm, and maternal conditions are also leading causes of death among adolescents and young adults. Tonight, we're going to discuss this with two newly appointed Deputy Surgeons General amongst our team at Alpha Phi Alpha. First, Brother Jalil Mitchell is a second-year medical student at the University of Cincinnati College of Medicine. He completed his undergraduate studies at Vanderbilt University, where he majored in neuroscience and medicine, health, and society. Brother Jalil is a proud Spring 2021 initiative of the Kappa Theta chapter of Alpha Phi Alpha fraternity. He also serves as the pre-medical board member for the Student National Medical Association. His academic journey reflects a deep commitment to both science and service, and he continues to build on that foundation through his leadership and work as a medical student. We also have tonight Brother Eric Craddock, who is a third-year Bachelor of Science in Health candidate at the University of North Florida with a concentration in public health. Brother Craddock currently serves as the chapter president of the Sigma Upsilon chapter of Alpha Phi Alpha Fraternity Incorporated, and he is our Deputy Surgeon General for College Affairs. After undergraduate studies, he plans on attending medical school and eventually securing a residency in anesthesia. Currently, Brother Craddock also works at Mayo Clinic in Jacksonville, Florida, as an emergency medical technician, where he gets experience in both ambulance operations and critical care transfers. Today, we're going to have a conversation with these two current and future leaders in healthcare. I hope that the older members of our audience choose to listen and gain an appreciation of the viewpoints, mentality, and aspirations of these representatives of our younger generation. Additionally, I hope the younger members of our audience come to appreciate the reality of our difficulties in healthcare and challenges of the healthcare obstacles confronting them now and into the future. Of course, we invite everyone in the audience to join this conversation by listing questions in the comments. We'll get to them as time permits. Welcome, brothers, and thank you for joining us today. Today, we're going to deal with 8 topics, maybe 9, depending on time, that cover 4 categories. We're going to talk about some physical health, mental health, public health, and preventive health. So let's get started. Topic number 1, you heard me mention that accidents were a major leading cause of death. So I love this when I talk to younger individuals, because you go through a period of life where you just believe you're Superman and you're impervious to any type of accidents happening to you. Tell me, guys, where does that come from? And is that still prevalent amongst this generation? Because for a long period of time, you had to at least get knocked in the head once or twice before you ever realized that you weren't um, invincible. What say you, Brother Mitchell?
Yes, thank you for that. And I think it's a very important topic because for people, young adults, this is the leading cause of death and accidents, over things like heart disease or cancer. So it's important to really take a look at why are these things happening. And, I think there is still that type of sense where being a young adult, you think that you are invincible. You think that, things aren't necessarily going to affect you. And then they end up affecting you, which is really unfortunate. And there are so many different ways that this comes into play, and different ways that are actually preventable, which is the key here to identify things that are preventable and what we can do to change things. So I think it is definitely something that still exists, unfortunately. And I don't know if it's about, being men, men are often risk takers and do things that we shouldn't do, unfortunately. But, trying to prevent that and trying to see how we can change our actions, I think is definitely important and a good talking point.
Okay. Okay, I hear you. So, Brother Craddock, now that I've told you, Brother Mitchell just reaffirmed that if this is actually the leading cause of death, and it is, of individuals between ages 1 and 44, I mean, what does it take for that information to permeate the psyche of young adults? Because young men typically don't show up in an emergency department like mine until and unless they're a victim of trauma. So how would you suggest that we try to get through to people so that they can do things that may not be viewed as the most cool, but are really important to prevent deaths in these younger age groups?
I think one of the biggest things that we can do, and one of the biggest things that kind of propel that, is that there's always this kind of this influence that younger people have, and I'm a victim of it myself, being a young adult. We have a chance that we know things are a danger. We hear it from the older people, and we have that wisdom passed down to us. But until we have those experiences firsthand, we won't kind of make that decision, that conscious decision to stray away from that. And a lot of the times, you'll see people that do have trauma close by in their families, or traumas happen to them personally. It's not until that happens that they'll start trying to make changes and choices that reflect that. They'll start being the person to propel. And I think in order to kind of bridge the gap between that, we have to make it known and kind of stand up and have that those young people that come up and say, hey, we need to realize that this is an issue. We need to realize that, we need to start thinking about our choices and actions before we do end up in the emergency room, or we do end up there, because a lot of the times we do try to see how far you can push that limit, how close you can get to that line without, anything happening. And eventually you're going to have consequences the closer you approach that line.
I hear you. Are there things that we should be doing that are generationally, culturally specific that can get through? Because back in our day, generation or two earlier, people just wouldn't do things that weren't cool. There was a point in time where you wouldn't put on a seatbelt until it became legislated that you did so, and there were resulting types of accidents that occurred. Riding a motorcycle was the epitome of freedom, and people just decided that, hey, the risk is part of the adventure. Are there specific things that we might think about doing to broadcast this message to the younger generation so that they don't have to wait to learn it one person at a time? Maybe something that isn't common or really isn't being done in a way that will get through to the younger generation. Either one of you can take that one.
Well, one thing that I think is that you are very correct in that young people oftentimes may hear things from older individuals, and it kind of goes in one ear and out the other ear. But for younger, older adults, being a good representation of what is appropriate, wearing a seatbelt is appropriate. So seeing a younger, older adult get into the car and put their seatbelt on is very important. Being able to have positive representations from people who are similar in age group to younger individuals can kind of get that message through, that it's not really a what's cool thing, it's a how can we understand how to best protect ourselves and prevent these things that are very preventative. So I think that being a good representation for younger folks is the best idea, and to kind of show it and not just say it.
Yeah. I like that. So what you're saying, what I'm hearing, is that we need to be the message, because despite what people may think, the younger adults, the younger generations are still listening and still watching.
Mm-hmm. Absolutely.
All right, let's keep it moving. Let's go to our next topic. Obesity. 70% of Americans are fully overweight or obese now. And there are cultural preferences around being thick, big bone, whatever you want to call it. By the way, if you look at x-rays, there are no thick bones. There's just a lot of adipose tissue, fatty tissue. How do we get this dealt with? Because the long and short of it, gentlemen, is that sets us up for all types of diseases, high blood pressure, diabetes. So I could go all night just on the consequences of obesity. Are we stuck in this cultural paradigm, or what do you guys think? How would you approach as future leaders trying to address the obesity epidemic that exists both in this country and in the African-American community? Let's start with you, Brother Craddock.
I'd say it's along the lines of we need to watch what we're putting out into media. I think now we living in the 21st century where social media and a lot of mainstream media is as accessible as picking up your phone every day. I mean, a lot of people wake up in the morning and the first thing you go to grab is your phone. Within the first 15, 20 minutes of waking up, a lot of people do access their phone and go on social media, especially younger people. And it's easier than ever to connect and see people and living their lives. And like you said, you have people that are kind of more like it's glorifying a thicker or larger, proportion person. And it's like, this is what's, people are kind of wanting to shift the societal norm towards. And it kind of gets those people that aren't a part of that group to the point where they feel like they need to eat more. They need to do things to get and obtain this ideal body when it's realistically not, probably in the best interest for health, even if they need to eat more, overeat, and they get excess amounts of sugars and putting off exercises and stuff like that. I think one of the biggest things to prevent that is letting people know that, it's perfectly fine to be who you are. It's perfectly fine to be in the body that you're in. You don't need to go outside of your way to be somebody else.
Brother, you have no idea. I'm getting all kind of flashes from 20 and 30 years ago. We would have substituted 30 years ago everything that you just said when we were talking about anorexia or bulimia. There was a point in time, a generation ago, where the exact same conversations, and we're talking about body dysmorphia. There's your word or phrase of the day, where people could not be thin enough. And the pendulum has swung in the other direction such that again, people are cleaning it up, calling it thickness or more desirable, pleasingly plump, whatever you want to call it. But once again, medically, it's obese, it's overweight. And by the way, coincidentally, we don't do body shaming anymore on people that are that because it's viewed as a bad thing. It seems as if body shaming in this country has been reserved for people that are actually healthy appearing, as they're often called, skinny or looking sickly. You're actually in medical school now, Brother Mitchell. What are we teaching medical students about the obesity epidemic and strategies to overcome it?
Well, I think something that is very interesting when talking about obesity is that, something about, the BMI being used, in the past that has been used as a criteria to say if your BMI is over 30, you're this category, if you're over 40 is this category. But something that we're realizing more is that is, more of just a screening technique, and there are more things that go into your health. And the biggest things about obesity that's facing the community is how is this putting individuals at an increased risk for, certain diseases, heart disease, diabetes, and how can we better understand what to do in these situations. And I think that medical schools can do, more of a better job teaching, someone commented about nutrition, because that's not something that's necessarily taught in classes, but something that's very important for controlling weight and trying to bring it down. But, we always talk about obesity is a contributing factor to this disease and this disease, but more so of how are we able to kind of fight it and combat it. And I feel like that's something that needs to be more talked about as well, for sure.
There are two things that came up that I just want to address. I'm going to take a second and point out to people, because I'm really tired of this conversation, because it reflects a lack of understanding, and people are focusing on the controversies around it instead of the point that's being made. The heart is nothing more than a pump. Okay, its purpose is to pump blood around the body, and it's containing oxygen and nutrients to replenish and nourish the rest of the body. The more weight that you're carrying and the more those arteries are clogged, the harder it is for the heart to serve that pump function. So, in a word, the BMI isn't some absolute thing that speaks to um, that is explained away by differences that are racial, ethnic, or otherwise. The fact of the matter is that it is a measure of the stress that your heart is having to work against, because that's kind of what high blood pressure is. But I digress in pointing that out. But there's another comment that I just want to point to, and James Henderson is on fire over here. Another thing that should be pointed out about nutrition and health is that the gut actually is, in fact, is a big part of your health. There's so much that's beyond the scope of this conversation. And if you are putting toxins, everything you put in your mouth either helps or hurts you guys. If you're putting poisonous materials inside of you, your gut is where that all gets worked out. And furthermore, the gut, because it's digesting all of these things where such that it can lead to obesity, that's a problem. So nutrition is a very big deal. I will point out to you, gentlemen, that actually, when I was in medical school, long time ago, we actually did learn nutrition. And it has made a tremendous difference in the way in which I've approached medicine. So I know that there's talk in the current administration about mandating nutrition as being returned back into medical school, and that would be a very, very good thing. So let's do a bonus conversation. No, let me just throw out an open question for both of you, because once again, I want to make sure that this is tailored to the younger audience. Again, what type of nuance needs to be made in this conversation such that it can permeate the hearts and souls of the younger populations here? And let's see either one of you gentlemen.
I think an important thing is recognizing what factors contribute to obesity in younger populations, whether they're maybe undergraduate students, graduate professional students, or even just people in general. Living in a stressful lifestyle, maybe constantly studying or constantly being under stress regards can lead to more of a sedentary lifestyle, or, a diet that's not the best. And, these type of things that are leading to obesity. And that's kind of what needs to change. And I think small changes are kind of where people can start if they don't want to make, bigger changes. Bigger changes are hard, but, thinking about small changes that you can make in your diet, whether or not maybe you want to cook more meals in the week, or you want to meal prep, or you want to try to stay more hydrated. I think those are some things that can be kind of small and put into your daily routine that you can track over time and see how are you making a difference in these measurable outcomes. And that's kind of where things can start to make, in the long run, become bigger outcomes for people in obesity.
Absolutely. Let's continue on. It's been almost a generation now where trauma and interpersonal violence has been identified as a public health emergency. It is part of the culture. You guys may remember how one of the monologues in the movie Friday, the original Friday, talked about how people used to deal with their problems via fisticuffs, and now we've moved the pendulum to where not only are conflicts resolved in many instances with guns, but that culture has become glorified. Let's do the same thing that we've been doing. We'll continue with you on this one, Brother Mitchell, and let's just talk about what, in your estimation, can be done to stem the tide and that makes the glorification of gun violence part of our culture.
Well, I think the biggest thing is how our media represents, that type of environment and represents, guns. It's everywhere. It's in the movies, it's in the music videos, it's ingrained into kids' head growing up that this is how you should act and this is what should be done. And that leads to, ingrained information that, that's okay. And that's a reasonable way to deal with issues that are occurring in your life, and a reasonable way to deal with, conflict, which it really isn't. And this goes into having information make that kids are exposed in young age, should be, and also knowing that in teaching, conflict resolution and teaching kids how to approach situations that aren't about violence is kind of a good way, I think, to start at a young age that will impact, people at young adult age as well.
Let me share something that the benefit of age and experience has taught me. Even if I stipulated that everything you said is true, even if there are external forces that, such as the media, that glorify violence and associate it with a specific set of communities in this country, that's not where the solution is going to come. The media isn't going to change those stripes. I believe, and the point of my question to you guys, and I'll direct this to Brother Craddock, is that self-empowerment is a thing. Our community has to overcome, not just accept the responsibility for making the change, not just overcome it, but accept the responsibility for it. So even if it's not our fault, it's going to be our responsibility to take care of our own community. So I don't think that the media started the genres of music that glorify guns. Now, of course, pretty much every newscast of my life, there's been reporting on gun violence, even Oprah representation of the extent to which there's gun violence. But, let me ask the same question to you, Brother Craddock. How would you think that we will be able to get past the glorification and incorporation of gun violence as part of who not only we are viewed to be, but who in fact we have become? And I know I just want to get your thoughts on it.
Yeah, of course. My biggest thing, yes, I do think media plays a part in it, but my biggest thing that I think is more of like from a mental standpoint and interpersonal. I think that a lot of people think that having a gun and having possession of a gun can give them power, and they're getting this false sense of security with having this gun and having a weapon on them, and it makes them feel much bigger of a person than they felt before. So they felt like without the gun they were less than and had less power and less control over something, and now with the gun they do. So they put a lot of they start idolizing the gun rather than everything else. So their attitude towards people, the way that they handle situations, and their inability for conflict resolution kind of shines and kind of portrays this vulnerability to create more violence. So for the ability of knowing that you can't, handle things with words or anything else, and knowing that, if I can't talk down the situation, I'm not going to try. I'm going to go straight to my weapon or going towards arms where I know that for sure I can handle the situation. It might not be the best way. It might lead to more violence and harm, but it's the way that I feel comfortable with, because this is what I think gives me power. And a lot of people think that with like a lot of words and conversations, like people are taking shots at them and people are coming at them as a man. And it's like a lot of the violence that occurs, and a lot of gun violence, a lot of people, like, I think it's more research and realizing that there are underlying issues. There are stereotypes and stigmas and issues. A lot of the violence comes from men. And that's why organizations like this, we need to take accountability and be able to be like, hey, it's okay to learn how to be a man and know how to be a man without having to resort towards other things like guns and weapons and things like that. So that was my biggest thing.
Yeah, now I would be remiss. I don't want to make this an anti-gun conversation, because we are in a nation in which stand your ground and open carry exist in many places simultaneously. And I would be remiss if I try to leave folks with the impression that we're advocating not protecting ourselves. Malcolm X was rolling over if that's the comment that we were making. So there's a qualitative difference between owning a gun, self-defense, and using guns as a measure of genocide, self-genocide. And I just want to stipulate that there are, in this country specifically, the rest of the world, not so much, but in this country, you can make very good decisions by being armed as a means of self-defense. So, If you live anywhere in Texas, for example, which is where I am, every house that you get showed more or less has a gun closet in it. So you don't want to be caught being the only person defenseless if indeed your family is being assaulted. But that's beyond the scope of this conversation. What we're getting at really is showing each other a little bit more grace, a little bit more love and deference. So stylistically, we have to learn to get to that point instead of shooting first and asking questions later.
Yes.
Let's move on to two mental health topics. Perhaps the most shocking thing about your generation has been the approach to stress. There were a lot of years in which members of the health community tried to turn the car around such that people would diffuse the notion of needing help, seeking out resources, embracing mental health support. The statistics are such, and this is not cause and effect, but the statistics are such now that rates of suicide and depression are so much higher now than they used to be. This is not a function of just increased diagnoses, but the response to stress is such that it's startling. Just to give you one example, I don't know if you gentlemen are aware of this statistic, but just over 25% of families have one child who is estranged from their parents at this point. And when asked why, that's typically a divorce as a means to avoid unnecessary stress and pressure. I'm not going to ask you guys a question here. I just want each of you to just kind of address the mentality that exists towards stress avoidance and to give your thoughts on why stress management seems to be so much, I hate having to phrase it this way, but so much less successful than it may have been previously. And it's not that people were seeking help, but there's so much higher a suicide rate and a depression rate. I just want you guys to just educate the older members of the audience on, from your perspectives, what's going on out there amongst our younger adults to make the world seem a hell of a lot more stressful than it was generations ago. And let's start with you, Brother Mitchell.
Wow, there's a lot of questions there that I think are very important. And I think that there are different, sides of the spectrum here. I think there are more conversations in younger adults about, how are we able to have self-care, therapy being something that I feel like actually in previous generations, that's something that's been not able to be talked about. Especially in Black communities, asking for help has seemed in the past to be something that wasn't allowed, that I see more and more people talking about nowadays. But the statistics that you presented seem kind of contradictory to kind of things that I've experienced and heard more being talked about. Especially there's been more, it seems like, support for therapy resources and peer support on student campuses. So it seems like that's something that is being able to be talked about more, but how it's being received and utilized by students seems to be something that might not be on par to how it's being talked about. So I think that's something to consider. Increased demands for younger adults nowadays, I think, is something that also contributes to increased stress. And are young adults able to know what resources are out there and how to utilize them, and be cognizant of those resources, is something that may be not on par with conversations that are being had about mental health.
Thank you. We're going to come back to that. Add to the conversation, Brother Craddock.
Yeah, I feel like that was a really great point, and I noticed the same things. I've noticed there has been an increase in the ability to talk about mental health and the ability to locate resources. And I think more than ever on campus, organizations and services have been offered. And I think a lot of it does stem from kind of being able to kind of use these resources effectively. I feel like therapy, it's either a lot of it financial reasons or any other, nuanced reasons and things like that people aren't able to get to it. But a lot of it is also, end of the day, just the availability of like things happening on social media and everything. There's so much content coming in, so many other ways to, come in contact with stress, and more stress, it feels more overwhelming. But then when you add more resources, you do give them more openings and doorways to get help. But a lot of times, if you have so many resources, you don't know where to go.
Yeah, I knew somebody was gonna hit the buzzword of social media. That is such a multi-dynamic part of the conversation and presenting false realities about what the norm is in terms of how people live, how they cope with things, etc. So you guys actually addressed, right on cue, our Deputy Surgeon General for Healthcare Disparities chimed in wanting to know what types of resources and tools appear to be working, and you two have both spoken to that. So thank you. But do either of you want to add an additional comment about the cause of such heightened levels of stress that require resources, or are we good there? Are these just resources that are, because people are failing, the statistics are going up in spite of the resources being available. So, we have to get back to the causality of it all, that some people choose not to engage in resources. You guys are talking about college campuses. Majority of Americans aren't in college, and there's still a stigma amongst groups in which people feel like it's a weakness. We haven't gotten rid of that in total, but that still exists. What I'm going to do here is I'm going to challenge you brothers. There's going to be a subsequent conversation on every one of these topics that we've been talking about, where we really are able and have the time to delve deeper into cause, effect, treatment strategies on some of the things that impact young adults. So we've identified this as an issue. Let's hold it there, and let's continue along with the conversation, because the next topic actually is a cousin to this in the mental health conversation. And we're talking about drug abuse and, in fact, overdoses. To what extent would you gentlemen describe increases in drug abuse and overdoses as a response to increased stressors, and the availability of drugs more freely? Obviously marijuana is here, there, and everywhere, and meth is available here, there, and everywhere. And so what do you guys think about that? To what extent we're in the midst of an opioid epidemic that affects young people as much as anything else? Getting back to the topic at hand, what is it about the stressors that's causing people to want to dissociate from reality, in your estimation, and choose drugs? Let's start with you, Brother Craddock.
Yeah, I think personally, a lot of the things that are tempting people to have increased use of things like drugs, narcotics, opioids, things like that, are just one, availability. It's really easy to get them. So a lot of times when you have increased availability, that kind of gives you a motivation to do that if you have that peer pressure. So it's multifactorial. It's not just oh, here is some drugs here, I'm going to do it just because of that. A lot of the people that I've talked to and that I've come in contact with on my campus and other campuses, a lot of the times they say that they didn't do it just because they wanted to, or just because it was available. It was because they see it everywhere. They're stressed, and they're like, hey, if they can do it, and they're telling me that it's fine, it feels great, this and that, blah blah blah, and there's minimal consequences for it, they're kind of peer pressured into it. I think that's one of the biggest things is if your friends do it, somebody else does it. Like I know a lot of people that know somebody. I think almost every young person either knows somebody or that comes in contact with drugs or uses drugs, or knows somebody that's relatively close by to them that knows that uses drugs. So I think it's more of peer pressure and just kind of the availability of it, those two coming together.
Brother Mitchell?
Yeah, I really like that idea of peer pressure and things being more so normalized in the young adult community, that or even glamorized, again, whether that's on people that are around you, your friends, whether that's on social media. It's seen as something that is okay, and it's the fun aspect of things that's portrayed, but the aftermath of using these substances, the withdrawal, the loss of connections, the isolation that's felt, and the negative consequences aren't what's being showed. So that's not on the forefront of things. And then especially young ages, people wanting to cope with the anxiety that they're experiencing and the pressure, using stimulants to try to help them get through the stress that's going on in their daily lives or their academic lives, or what's going on there, emotional trauma and baggage that has been dragging along with people are kind of I think leading to these with young adults. And especially when we were just talking about not being able to talk about issues and people and problems that people are currently experiencing, this can also lead to unhealthy ways of unleashing all of those issues that someone's experiencing in life. So I think that those are all kind of contributing to how people are approaching drugs and using them, and again, like Brother Craddock said, in a multifactorial way.
That's brilliant. You actually would be surprised. I hark back to my high school prom. It was nothing less than a cocaine party around a pool on the 50th floor of a skyscraper. And there were a group of us that just sat there in awe watching everyone else mix the two. And it's a wonder that the peer pressure that was involved in that party didn't result in a bunch of deaths. So I certainly appreciate the extent to which that's a part of the conversation and can lead to consequences once people get that first taste. Let's switch gears and let's go over to public health, because I think that this is a great place to pick that up, because you both have mentioned access and availability of resources. I'm an emergency physician by training, and I've mentioned that trauma, accidents, etc., are the number one cause of death in ages between 1 and 44. And the stereotype amongst men in general is that they don't show up to the emergency department unless they're a victim of trauma. Men are different. We don't have OB-GYN to the same extent. Urology is not that. So women are better, and this was at a very early age. And to some significant extent, that results in the increased life expectancy, the difference in life expectancy between men and women. I want you two to just speak to how you would recommend that members of your generation learn to navigate the healthcare system, how to utilize different parts of the healthcare system, and why that might be important to start at such an early point in life. Go ahead.
Yeah. So my biggest thing is, I think it's really important to learn how to navigate the healthcare system. I think that learning that at a young age will give you that opportunity to realize and make mistakes and realize kind of what you're trying to what it is, because it's not easy. There's people that are well into being later in life, stuff like that, well into having decades of using the healthcare system that still don't understand it. It's something that you're not going to get in a day, a year, a couple of years, stuff like that. It takes experience firsthand. It takes education and a will to reach out to people, to network, to be able to talk and have conversations and be willing to learn. I think that it's one of those things that are ever changing. One day you could walk into an ER and have a healthcare plan, you could be completely, taken care of. And the next day, through public health policy and planning, stuff like that, you could more than likely not be covered with your bill. There's a lot of things that people don't realize, like things like the differences between going to an ER and going to an urgent care, and when I should go to the hospital, and if I'm going to be turned away or stuff like that, or is it that important? Am I truly sick, or am I kind of going to be wasting my time? And a lot of people focus on having a healthcare bill after rather than their own health, and it's a lot of the times where it's like if you were able to navigate that system a little better, then it'd be a lot more positive.
Absolutely. Let's keep it going, Brother Mitchell.
I like this topic because I think that it provides, a great route for programming, because it's really not, insurance is really not something that's, taught. It's not taught in undergrad. It's really not heavily taught in even like medical school, where, you're trying to train physicians who, have to consider insurance in many different ways. Understanding what type of insurance you have, whether you have a copay or deductible, is very important to understand how to approach and navigate the healthcare system. And I think that everyone should be more knowledgeable on how to get insurance, what type of insurances they can do, what can they do with the type of insurances that they have, and what's available through their insurance. And people also need to know that, for example, there are many different reasons to be able to navigate and approach the healthcare system. And just because you feel okay right now, there might be things subclinically that are going on that might need attention. And, establishing care with the primary care physician, and then also seeing what resources are available to you, like annual healthcare checks, STI screenings, and actually advocating for that is really of utmost importance to get an early start on healthcare.
So I want to share, thank you for that. I want to share with the younger members of the audience 2 facts that everybody should know, whether or not you do. In America, the number one means of accessing health insurance is actually through a job. So make sure that you're talking to your employee benefits program to learn what your options are in that regard. And also, you do get to stay on your parents' insurance. That's part of the Affordable Care Act until you're about 26 years old. So, ask yourself when the last time was that you had a checkup. Much of my work in medicine deals with health prevention and promotion. There's a huge difference between healthcare and medical care. Stay healthy so you don't have to try to get well. An ounce of prevention is worth a pound of cure. Just because you feel well today doesn't mean that that's going to be the case tomorrow. So please, 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 if you haven't had a checkup in the last 6 months or so, should be getting HIV testing every 6 months, just to give you one example. Call your physician, other healthcare provider, and get yourself taken care of. Now, the other thing on this particular topic that I wanted to get at, public health that is that these days, everybody's Dr. Google, right? Misinformation and disinformation has never been higher. And it's very important for individuals who are still young and impressionable to be able to figure out what sources on public health matters and medical matters are actually credible. So let's ask you 2 gentlemen, how do you do it? Not you in the royal sense. How does your generation actually ascertain where to get information from? And I can't tell you how many dozens of people send me stuff every single day, and my response more often than not is consider the source. If it's not a credible source, then you can pretty much infer that much of what's being presented isn't going to be part of the medical standard of care. So let me go back to you again, Brother Mitchell, and talk about navigating credible health information, because Facebook, Instagram, et cetera, for the most part, are not reliable sources of health information and advice.
Well, yes, I would say, unfortunately, that it is a lot of times where people are going towards and seeing things that are online that really have no basis, don't have any medical backing, and a lot of young adults right now are on TikTok, and you really don't know who to trust. People are kind of posting things just willy-nilly and not actually having the credentials to back it up. And so that is a big problem. Something that we also see when patients come into the office saying, oh, I saw this on TikTok, or I saw this, or, Dr. Google, I asked ChatGPT this. And the biggest thing I think really to understand is that understanding that those type of resources aren't going to be the professionals, aren't the people who did training, isn't evidence-based, is something that needs to be more so pushed out. Understanding that, what websites are we looking at when we're looking at information? Did it come from a .gov? Did it come from a .edu, from the CDC, national organizations of people who are professionals and doing research and understanding health? I think is kind of where the separation comes in, but people really don't know how to look up that information or how to do the literature searches. Like, that's not something that people really maybe care to do or know how to do.
Yeah, trusted messengers. That's kind of what it comes down to. If you don't have trusted sources, based on what's happening on the federal level in distorting information that came from historically trusted sources, you still have access to trusted messengers. You want to pick up on that, Brother Craddock?
Yeah, I think he hit it right on the tee with that, and a lot of it is figuring out, are you looking at a credible source? And a lot of the things that I tell a lot of people, and I try to do myself, is to be skeptical of every piece of information that you find. I feel like a good amount of skepticism is good. I feel like if you trust any and everything that's given to you, then you're bound to fall to misinformation and stuff like that. I feel like asking questions is a good thing. Like, okay, it's great that you shared this with me. Like, where did you find this at? Like, can I see the article myself? And then, so you could see the website, so you can see where it was from, and realizing, like, is this a peer-reviewed article? Is this something that people have done research and it's been looked at about other experts in the field, things like that? Those are things that you can trust, more readily than that. And I think, taking that pride and being able to, have a good interest in it goes a long ways, because a lot of people will have things that, and I tell people all the time, like, confirmation bias is everywhere. You can find articles that can support your beliefs anywhere. You can say anything and find an article that supports it. That's one of the biggest things that I say all the time. It's like, what context are you looking at the information in? That's a really big one for me.
Yeah, you two are either very prescient or just very wise at very young ages. You will, over the course of your careers, perhaps look back to this and see how right you were 20 or 25 years from now. I want to share a quick story with you about something that literally happened a few hours ago, since we're on the topic of Chat GPT and how it's going to be replacing all of us and taking our jobs. I had somebody come to me saying that Chat GPT told them that they had ovarian cancer based on their symptoms. And she had literally been prescribed medicine for a urinary tract infection a couple of days ago. And the way in which that works is that it turned her urine a certain color, and the rest is history. So before we get replaced by the robots, just remember, trusted sources, trusted messenger. And one thing I want to follow up on, guys, believe me when I tell you, and I'm talking to everybody out there that has been a patient whose family might get sick, make your doctors do their jobs. If they do not convince you and educate you on exactly what's going on, you haven't done your job in making them do their job. Ask those questions. Look to learn while you were in front of us. I've told so many physicians I can't even count anymore that if you can't explain it effectively, then you really don't know it. You can't just wave your hand anymore. That's way generations ago, where people would just accept your proclamations as gospel. You have to talk to people. You have to educate them to be stewards of their own health care. That is the time in which we're in, and that's the future that I think we're going to see moving forward. People have to be educated about their health conditions so that they can do a better job taking care of themselves. All right, two more topics in the time that we have allotted. Preventive health. I always love saying that everything you put in your mouth will either hurt you or harm you. So let's talk about ways to eat better. Let's talk not dieting, but let's talk about nutrition. And along the same lines, in health prevention and promotion, let's talk about stress avoidance as much as stress management. It's always better to not have to deal with disease than to have to manage it once it presents. Brother Craddock, why don't you just jump on that and just give any advice you have to people about what you've learned at this point in your career on managing health prevention as opposed to having to deal with illness once it presents?
Yeah, I think one of the biggest things that I've seen, especially with my job and my occupation, is once it gets to the point where it's presented, it's not it's not the best time to do things. It's about the best time to do things before you get to that situation, because prevention goes a very long way. Because once you're at the stage of management, all you're trying to do is minimize damage rather than trying to prevent it from happening in the first place and staying healthy. And one of my biggest things would be like plan ahead. Nobody ever plans to be sick. Nobody ever plans to do anything negative. But my thing is being able to know that, okay, if I'm trying to avoid stress, if I'm not trying to avoid all of this, can I get my week planned out early? And being willing to accept there might be changes to it. There might be issues, and having a checklist and setting goals. Those are some really good things that I have that I do myself a lot of the times. And it's like I can know for a fact, if anything else in the future goes wrong, I did everything I could to attempt to prevent it. And you can do and have the same approach with your health very well, and making sure you have a primary care physician and having all of that lined up. So,
And see, this is where I remind people that you're a pre-medical student, but you're already an EMT. So you're not dealing with ambulance patients that are, for the most part, eating large servings of fruits and vegetables on a daily basis before they've had that stroke or heart attack that necessitates them coming to see me or my colleagues in the emergency department. So yeah, that's pretty good. Now, let me just twist that a little bit for you, Brother Mitchell. You're in medical school. What are we teaching and saying about those same considerations right now in medical education?
So in terms of, I guess what I would say, are you talking like in terms of how, as a medical student approaching this topic and
Yes, again, I'm trying to create some nuance between stress avoidance and stress management once it appears. I'm talking about healthy eating because, we always try to point out to people always say, oh, I have type 2 diabetes because it runs in my family. Well, no, you have the same unhealthy cook preparing meals for everybody around the table, all of whom subsequently develop diabetes. That's a distinction with a huge difference. So what I'm asking is just give us an idea of in what measure, certainly not equal measures, but how much of medical education is actually involving health prevention and promotion and not just treatment of medical illnesses.
Thank you. I think this as well is something that isn't, the main thing. We're really just taught about studying disease processes, and after something presents, this is what you should expect to see, and this is how you should treat it. But the prevention aspect is something that's definitely missing from education, and it's something that's also, in terms of us being students, is something that's talked about. But how is a school as an institution trying to prioritize that aspect of even students, us as training doctors, prioritizing our physical well-being and prevention as well? I think is very, very interesting how, as student doctors, we understand that this is important, but even us as students may not be even prioritizing this as well. And it's a topic that's definitely not prioritized. It's really what it really is prioritized is a patient presents with this disease, is all these things that could have been prevented before aren't what we're focusing on, but it's the disease and the medication, and it's something that shouldn't necessarily be the way that it is. So I definitely would agree with that.
Yeah, so this is a real opportunity, and I'm asking these questions knowing the response, but we've gotten past the day where that's just acceptable. Medical curriculum need to include nutrition. It needs to include considerations of alternative approaches to health. Naturopathic, there's so much to learn, and you literally are going to have to learn these things at some point. It would be nice if these things were part of medical education, which is why so many of us get additional degrees to help us provide a more comprehensive level of care to our patients. So with that in mind, we are to our last topic. So let's switch gears. We got to talk about vaccinations, right? So that combines a lot of the other things that we've talked about: misinformation, disinformation, public health, health prevention and promotion. As much of the blather that is occurring amongst the older members of the population and the political classes in this population, just share with us, if you will, and we'll start with you, Brother Mitchell. How's the younger population interpreting this, receiving this? Are you being swayed, or is this just being looked at as some foolishness that people are discussing for political gain?
This is a very interesting question, and where of course how medical professionals view vaccinations, but even in the younger crowd, there seems to be some people who are for it and some people who are against it. And I think that at a young age, a lot of people don't necessarily know where to look to, or don't necessarily know why vaccinations are important in preventing, the many bad things that they prevent. And then seeing government officials kind of sway a certain way, even at a big stage like that, our big organizations that have always been pro-vaccination, not getting the funding to kind of operate, is kind of leading us into just a horrible trajectory that will really, unfortunately, unveil things that may have been may have been talked about before, and then even at a younger age, people may not grow up understanding the importance of vaccinations. I would say.
Okay. What do you have to say, Brother Craddock?
A lot to the same light. A lot of people that I've talked to and I'd have, it's a lot of mixed opinions on it, and a lot of it that I've seen that's been consistent is just a lot of lack of like education on it, because a lot of people have a lot of opinions that were passed from maybe their parents or people that are a lot kind of close to them, and we have these opinions being formed by them, whether it's for them or against them, and not really based in any real scientific or medical knowledge. So a lot of it is just kind of realizing how much of this is something that I'm believing socially, or is it something that's backed by information that's kind of provable. And I think personally, having that self-reflection and knowing like, okay, well, maybe I should look out and look at the benefits of vaccination, because a lot of the things that have been eradicated or nearly eradicated have came from vaccinations, and the life expectancy since antibiotics and vaccinations have been a thing has almost doubled for us. So I think taking that first step and being able to kind of realize that is really big.
I can see you're being very well educated. That was a great series of great responses. And the word that you said, Brother Craddock, that I want to continue to point out is opinions. You can have your opinions, but you can't have your facts. So people have mixed opinions, but there are no mixed facts. The data is incredibly clear. All you have to do is follow the trend lines and the correlations between vaccination rates and disease, and you can take the rest of it and drive a truck through it. We are running the risk to extend the metaphor of allowing our ignorance to drive us off of a cliff. But we'll get to that and continue to get to that as we have these conversations. As we come to a close, I want to just invite each of you to speak your mind. If there's a message that you want to share with your colleagues, your generation, or to the older population that's watching this, speak to your priorities as deputies for college affairs and graduate and professional affairs, respectively. Let me just give you a minute or so and just have at it. Let me start with you, Brother Craddock.
Yeah. So all I'd like to say to people that are my colleagues, college students, I'd like to say is, be able to put your health first, put learning about health. You can't help anybody else if you haven't helped yourself first, and realizing that, it takes a village in healthcare. It's not something that's going to be learned by yourself. It's not something you should navigate by yourself, but having the right resources and going about it yourself is or going about it the right way is really pivotal, especially at a young age, because you're going to have to learn it at some point. It's best to do it while you're young and you're able to know all this, because it's going to help you so much down the road. And one of the things that I like to say to the older generation, people like that, is like, keep passing down the wisdom and your experiences to us. I feel like that's really big, being able to know these things, because there are a lot of things that kind of get passed down and that are misinformation and not rooted in fact, and being able to come to our generation and to impart that knowledge it's really big. That's one of the things that I'd have to say, really.
Outstanding. It's great having you on the team. Brother Mitchell.
Something that I would say, because I think the population of people that comprise graduate and professional students, it can be very interesting. You could have somebody who just graduated college, might be 22. You might have someone who could be 60 years old. But something about school in this time frame is that it can be, very isolating. And of course, it's very challenging, and a big difference for people who are, taking this big initiative and this big step to develop their career. And I think something that, even for me, that I'm working on, that I always challenge other people in this same arena to work on is making sure to prioritize their personal well-being, their health, and, don't give 100% to just one thing. Try to, go to bed when you're tired. Try to eat healthy. Try to maybe go for a walk throughout the day, and prioritize these things by, for example, putting in your schedule. making it something just like you schedule your classes, just like you have a schedule for your exams, scheduling these other things that should be very important to your personal health and well-being. And to older people as well, or people who aren't in graduate or professional school, you probably most likely know somebody who is. And again, speaking to the isolation that many people are experiencing, the stress and those type of environments that they're in, reaching out to check on these people that you know are in these type of situations, and offering your support, offering help, and offering yourself as a person that they can come and talk to in terms of the stress that they're experiencing and the mental challenges that they're going through.
That's fascinating. I would dare say that we are in good stead with leaders like yourselves on the horizon. And I want to thank you both for not only joining the Surgeon General Initiative, but participating in tonight's webinar. We look forward to more conversations with you on topics of interest to the younger members of the population, and interspersed with global conversations that affect the African American community and the national community as well. Tonight, I just want to follow up what you've heard from these two younger members of the health team is something that I talk about a lot when I discuss health prevention and promotion. We are in a unique time in history. The body of knowledge, best practices exist. So much of the nonsense and the clutter can be pushed to the side. There are best practices, there are standards of care such that life expectancy and quality of life can be achieved. There are more octogenarians and other individuals, even those living past 100 years, that you can actually plan on such things if you choose to implement best practices. The sooner you get involved in taking care of your health, the further out you're going to have to deal with your illness. So I just want to continue to encourage all of you to be the best stewards of your own healthcare, not your physicians, not even your family, but take the responsibility. Surround yourself with individuals who are trusted messengers every single day. Work as if your life depended on it, because at some point in time, it actually will. And the way in which you enter an emergency department, an ambulance, an intensive care unit, the likelihood of how you leave that place will in large part have to do with how you entered that place as relates to your prior health status. So as always, we thank you for joining the Alpha Phi Alpha Surgeon General Initiative webinars. Come back and view again next month. Have a lot of topics that are going to be leading into our general convention, and we'll be talking about all of those that have applicability for how you live your lives on a day-to-day basis, as well as for those individuals that will be participating in our convention. I want to thank you guys, as always, for participating, and we'll be talking to you soon. Be safe, be healthy, and good night.
Thank you.